I'm Robin Hackey, Executive Director and co-founder of the Center for Community Investment. For the past 4 years, we've been working with hospitals and health systems aiming to improve the health of their communities by investing in the social determinants of health, specifically in preserving and producing affordable housing. In this video, you'll hear how 3 health systems have worked across departments, from community benefit to finance, from government relations to real estate, in order to bring to bear all of the skills and resources of their systems to advance affordable housing in their communities. By doing so, they've been able to make grants, loans, guarantees, even donate land so that the communities that they serve can benefit from more stable and affordable housing.
So we here in Community Benefit, Community Health, we're doing all these initiatives, and we realized that we were running into our limits of what we could deploy. And so my simple mind was investments. Oh, Treasury does that. Let's go knock on the finance door and start asking them about could we start redirecting some of those investments that they make in Wall Street and direct them towards Main Street here a little bit to do impact investing. So that's through many months, though, of conversation, getting them comfortable with that idea that we can still get a return. The yield financially will be slightly lower, but the social return will be so high. And they started getting comfortable with that. Then we started pointing to other systems, health systems that were already doing this as inspirations, maybe as a little competitive juice and fire. But nonetheless, they finally got it and said, okay, we could free up some money for that.
It's about doing what you can when you can and evolving your strategy to kind of keep that big picture and stuff in mind and build the trust and kind of commitment it takes to really start addressing some of these larger community level factors.
I think if you are not in alignment from a value-based arrangement, what I think really drives this is the ability to leverage resources and to bring these other players to the table and to be that convener, to be that partner, to be the assembler. If you can donate land, there's many ways for you to show up, but it is important work, and it's work that's valued by the community.
I guess what I would also add is that to adopt an all assets mentality to this as a health system. This is not just community benefit, and it's not just sort of fulfilling some not-for-profit or IRS 990 kinds of things. If you're really going to think about investment in a community and building it and helping develop it, you can think about the grant making you can do and some of the CB sorts of kinds of things, but you also have to think about your finance department and your treasury assets. You think about your real estate.
There's a couple of different ways to get there, and it's just all a matter of whatever narrative works for you and the leadership of your organization.
I started with where we went to our treasury and said, can we free up some money? So there wasn't, whatever they were able to free up became the balance that we needed. All right, we've got X millions to work with. What can we do with that? And then how do you support that with grants? How do you support that with other sort of assets?
And so for us, it was really a matter of, if we're going to be embarking on this work, what departments are currently engaged, at these various levels? And what does that really mean to start pulling these things together and doing this in a way that we're adding value the whole way? Because if we're just, letting the community relations department administer, kind of our philanthropic money, and it doesn't align with where these investment dollars go, we're leaving a huge value add there.
But you have to dedicate FTE time for this. It's not just at the side of someone's desk that this kind of work is. Treasury has set aside an analyst who half of his time is working with us, where we've dedicated half of someone's time to think about the mission side of this. So you marry the mission and the impact that you want to drive with the finance savvy, and then together that becomes your program.
One group that you really can get on board early and who is a voice advocating to have that ongoing FTE support is your government relations team, because the goodwill with the government, right? Whether it's your state or your local institutions who impact everything from obviously your Medicaid funding, which is a big deal in the pediatric world, to your local ability to access ARPA funds are, that's huge. And CEOs and government relations folks understand that. Your Treasury folks will as well. And so when you connect that dot between housing and the impact to GR, then people start to get on board more quickly.
The mission to improve health is so strong, though, that at some point you realize, the care that you provide just isn't enough if you're really going to be driving health this way. And I think that's an easy thing that was able to tap into people. And then what that does is it's surprising and shocking once you kind of go around and start evangelizing this idea a little bit of, well, what about the real estate department? Well, what about Treasury Department? What about HR and thinking about hiring differently and programs we could develop for entrepreneurs or jobs or something like that? It's in there. I mean, people come to healthcare for a reason, even in administrative roles. And if they come to a not-for-profit mission-driven one on top of that, I think you're able to tap into something there, and you realize there have been people who've been thinking about and dreaming of, gosh, how do I do more? How do I contribute more? I don't provide a surgery. I don't touch patients. I don't take temperatures, but I'm over here in this department. And you unleash people this way, and you'd be surprised how many champions are ready to kind of join you in this.